It's amazing to see how the estimates that come out of the studies that we do can actually change policy and make a difference in the lives of children globally.
Policy partnership is just fundamental to everything we do. My research is to try to find services that will improve the lives of children and adolescents in Africa and in low and middle income countries.
And I work on computational statistics, machine learning, artificial intelligence applied to global health. We met 5 years ago.
Yeah, our kids go to nursery school together in the university nursery. So there was much discussion of data science over the playground.
The policy partnership that we've been working on together is the Global Reference Group on Children Affected by COVID-19 and Crisis.
I've been working for 15 years with a colleague at the US Centers for Disease Control. She rang me up one day and said, you know, we've been working together on AIDS orphanhood for 15 years. And what about the children orphaned by COVID? We're going to need the best modelers in the world to try and find out how many there are and where they are. And I said, that's lucky because there's a dad at my kid's nursery.
And it turned out we needed to combine expertise from epidemiology and from demographic methods in order to know this number.
When we started, we had no idea what the numbers were going to be like. And they are huge. 12.4 million children have lost a parent or primary caregiver due to COVID-19. And that's really ignited a huge amount of press interest. You need to be prepared for this. You need to set up systems and services and responses.
One of the earliest policy impacts that we became aware of was a lawyer in Brazil who read our work, was responsible for child protection. So she then took this information, went to the local policymakers, and they've actually passed legislation to provide support specifically for children who've lost caregivers during the COVID-19 pandemic.
And in Malawi and in South Africa, they've expanded their social protection program specifically to include children who've lost a parent or caregiver due to COVID. The World Bank has set up a new rapid social response fund, which countries can apply to get funding and support for COVID-affected children.
The work that we have done together has brought the importance of this crisis to the forefront of the policy dialogue. The support that we are receiving in terms of research and data so that countries can respond appropriately is invaluable.
We are a very small team at Save the Children and we have very limited capacity. So having professional researchers we can work with is absolutely essential to improve the situation of children.
One of the challenges that we face with this work has been that sometimes the timescales are a lot faster than we're necessarily used to with careful, rigorous academic research.
That's where PhD students and postdocs are great. They can dive in. The project's still expanding. The big crises coming up are climate change, conflict, and new epidemics. So we're thinking about what evidence do we need to build now to get better prepared for protecting children.